Hello, my name is Mariana Rodriguez Sanchez, and today we're going to talk about spina bifida. Spina bifida is a condition that affects the spine and is usually apparent at the birth. It is a type of neural tube defect. Spina bifida can happen anywhere along the spine if the neural tube does not close all the way. The backbone that protects the spinal cord does not form and close as it should. This often results in damage to the spinal cord and nerves. It might cause physical and intellectual disabilities that range from mild to severe. The severity depends on the size and location of the opening in the spine and whether part of the spinal cord and nerves are affected. This is one of the most common types of neural tube defect, affecting an estimate of 1 in 2,500 newborns worldwide. For unknown reasons, the prevalence of spina bifida varies among the different geographic regions and ethnic groups. In the United States, this condition occurs more frequently in Hispanics and non-Hispanic whites than in African Americans. Okay, there are several different types of spina bifida. We're including the myelomeningocele, meningocele, and spina bifida occulta. The first one is myelomeningocele. This is the most severe type of spina bifida. The baby's spinal canal remains open along several vertebrae in the back, allowing the spinal cord and protective membranes around it to push out and form a sac in the baby's back. The meningocele is another serious type of spina bifida, where the protective membranes around the spinal cord, the meninges, puts out through the spine. The spinal cord usually develops normally, so surgery can often be used to remove the membranes without damaging the nerves. And the spina bifida occulta is the most common and mildest type spina bifida. One or more vertebrae does not form properly, but the gap in the spine is very small. Spina bifida occulta does not usually cause any problem, and most people are around where they have it. Spina bifida can be diagnosed during pregnancy or after the baby is born. The type occulta might not be diagnosed until late childhood or adulthood, or might never be diagnosed. During the pregnancy, there are screening tests or prenatal tests to check for this defect and other birth defects. In some cases, spina bifida might not be diagnosed until after the baby is born. Sometimes there is a hard patch of skin or a dimple of the baby's back that is the first seen after the baby is born. A doctor can use a match scan, such as an X-ray or a CT, to get a clearer view of the baby's spine and the bones in the back. The treatments for the symptoms or conditions associated with spina bifida can include the surgery soon after the birth to close the opening in the spine and treat hydrocephalus, therapies to help make day-to-day life easier and improve independence, such as physiotherapy and occupational therapy. Assistive devices and mobile equipment such as wheelchair or walking aids, and treatments for bowel and urinary problems. With the right treatment and support, many children with spina bifida survive well into adulthood. If you want to know more, there is my references.